In this procedure, you will learn how to position and drape the patient for examination of the rectum, installation of rectal medication, perineal examination, and some pelvic examinations. Greet and introduce yourself to the patient.
Good morning, Jennifer. I'm Julie, Dr. Anderson's medical assistant. Before we get started, can I get your name and date of birth?
Sure. Jennifer Jansen, June 23rd.
Then confirm the patient's identity using her name and date of birth.
Great.
Sanitize your hands.
So have you had a rectal exam with Dr. Anderson before?
Yes, I have.
Determine whether the patient understands the procedure. If the patient does not, explain what to expect.
So you're familiar with the procedure, and you'll know that we'll be putting you in a certain position for that procedure.
Depending on the provider's preference, the patient may be instructed to completely undress and put on a gown so that it opens in the back, or to just undress from the waist down.
And I'm going to need to have you undress from the waist down and put the gown on with the opening down the back. Do you need any assistance with?
Provide assistance as needed.
No, I'll be fine.
Great, I'll give you some privacy for that.
Thanks.
Give the patient privacy while changing. Knock on the examination room door before re-entering to make sure the patient has completed undressing and gowning.
Come in, I'm ready.
Hi, Jennifer. How are you doing today?
Good thing.
Do not place the patient in the Sims position until the provider is ready for that part of the examination.
Okay, I'm ready to do the rectal exam, Julie.
Pull out the table extension. Help the patient turn onto her left side with her left arm and shoulder drawn back behind her body so that she is tilted onto her chest. Flex her right arm upward for support, slightly flex her left leg, and sharply flex her right leg upward. Help the patient move her buttocks to the side edge of the table. To provide her warmth and privacy, drape the patient over any exposed area that is not included in the examination. For female patients, the drape should be large enough to cover from the breasts to the feet so that the patient is not exposed accidentally if she is asked to roll over. After the examination has been completed, assist the patient as needed to get off the table and get dressed.
Okay, do you need any help getting off the table or getting dressed?
No, I think I'll be fine.
All right, I'll give you some privacy.
Before cleaning the exam table, put on a pair of disposable gloves. Dispose of used examination table paper according to facility policies. To prevent the transmission of pathogens from one patient to another, use disinfectant wipes to clean the exam table and all potentially contaminated surfaces. Then dispose of your used gloves. Once the exam table is dry, pull clean paper over it. When you're finished, sanitize your hands. Follow up with the provider's orders regarding scheduling of diagnostic studies, collection of specimens, and/or scheduling of future appointments.